Good evening to everyone and welcome to today's NEET PG mock test MCQ discussion. Every day we have 100 MCQs, next 40 days, 40 tests. So they're all available in the Incus learning app. When you go to the course marketplace, there you can click on NEET PG. There in the quizzes, you have the package of 40 NEET PG full-scale mock tests daily, along with discussion in the evening. So your job is easy by that way. Fabeha, Rashid, and many more who are all online. So just wake up in the morning, you find a new test, 100 questions, solve it, and then you will get an analysis. How many you did right, you did wrong, etc. Then evening, 6 o'clock, Dr. Murali Bharadwaz will be all yours to have a discussion and try to understand 10-15 topics every day you pick up where you are going wrong. But next 40 days, if you do this religiously, ceremonially, there is nobody who will stop you from becoming the topper in the tomorrow's NEET PG exam. With all this preamble, let's make the great beginning of the today's full-scale grand test discussion, doctor. If you answered the questions before coming to the discussion, this will be more interesting. But otherwise, it looks like a Shatabdi Express. I'll go very fast, mainly to touch base. The emphasis on the topics, that is most important. Okay? Now, the obsessive compulsive disorder. The obsessive compulsive disorder. These are all true, except there is a contamination, pathological doubt, guilt, aggression, no catatonic posturing. Now, chronic fatigue syndrome. सुबह से शाम तक नीट पीजी बोल के जपन करते हुए आप रीडिंग रूम में बैठ गए तो क्या मिलेगा? Chronic fatigue syndrome. For that, cognitive behavioral therapy, graded exercise therapy, pacing, they're all important, not electroconvulsive therapy. So persistent, unexplained fatigue characterizes the chronic fatigue syndrome. Treatment is cognitive behavioral therapy and graded exercise therapy, pacing. So pacing is what? Energy management strategy. Symptoms of the illness will tend to increase following minimal exertion. Pacing. There is a symptom contingent pacing, time contingent pacing. That's how at least one keyword समझने की कोशिश करो. Pacing is a word which you need to remember. Now, late onset schizophrenia. When do you call late onset? If the onset is after 45 years of age, you call it as late onset. It typically develops after 40s. It is mostly paranoid subtype of schizophrenia. 40 umar ke baad agar pagal ho gaya to you have fewer negative symptoms or learning impairment. Already learning is over, right? They will be able to run a near normal life. Rapid cyclists in bimaniac bipolar disorder. When do you call rapid cyclists? If mania, depression. If that is alternating 4 episodes per year, you call it as rapid cyclists is what you need to remember. Now, avoidance of the awareness of the pain of reality by negating the sensory data is what kind of denial mechanism? I mean, defense mechanism, which is called denial. Somebody will have a severe chest pain of heart attack. They will try to think, oh, this is just epigastric distress, until they get ventricular fibrillation. So denial is one of the very common reasons, especially among the medical professionals. Typically, denial is the one which make the medical professionals who got heart attack. They are great doctors, but by themselves they got heart attack, they could not go to the hospital. It was all because of the denial is what you need to remember. Displacement क्या होता है? If you shift an emotion from one object to the other, for example, there is an unexpected, unacceptable, aggressive feelings by a medicine professor towards his wife. Originally, he is not happy with his wife. He fought with her early morning on the breakfast table. Then he comes and shouts on the MD resident in the morning rounds. That's an example of a displacement. Distortion क्या होता है? Distortion is the reshaping of the external reality to suit one's own inner needs. For example, a singer is told at an audition that she needs a lot of work to make her voice stronger. So, blocking means inhibition of thinking. Isolation is splitting and separating an idea from emotion, which accompanies that. Similarly, dissociation. It is a temporary but drastic modification of a person's sense of personal identity is called dissociation. So Sigmund Freud classified defense mechanisms into narcissistic, immature, neurotic, and mature. So narcissistic are primitive, denial, projection, distortion. Immature is they're acting out. Introjection, passive-aggressive behavior, somatization. Neurotic, displacement, rationalization, repression, they're all neurotic. Sublimation, altruism, anticipation, suppression, and humor, they're all considered to be mature. So people will throw their jokes. A bald man throws jokes about baldness. That is a very mature mechanism. Sense of humor is the mature mechanism. So what is projection? So it is an act of perceiving and acting as if the unacceptable internal impulse is coming from the external world. Is called as projection, is what you need to remember. Sublimation क्या होता है? If you transform an unacceptable social impulse into an acceptable one. For example, there is a painter. He has a lot of sexual fantasies. But he can't be able to do all the fantasies that are there in his mind. So what he has done, he took up a brush and started painting so that a painting which is nude is accepted socially. But to run nudely in the street is not accepted socially. So that is a classical example of a sublimation where you are transforming an unacceptable social impulse into an acceptable one, is what you need to remember. Then altruism. So it is basically doing service to others. A lot of times when we do service to others, it gives satisfaction to our soul. Our own internal instincts are all gratified. That's called altruism. So that is all the psychiatry. So what is the conclusion? Defense mechanisms you have to study. It definitely आने वाला question है psychiatry में. So go back to the Incus learning app. There you go to the courses. There you go to video courses. And there you have 2000 HD videos ka courses available. In that, go to the psychiatry chapter. And there you have the defense mechanisms ke bare mein एक 20-minute रिविजन वीडियो अवेलेबल है, आप गर्मा गर्म रिविजन कर लो. Now, HIV patient who has TB, he will become atypical. So one of the atypical features is cavitation is less common in HIV plus TB. Cavitation is less common with HIV plus TB rather than TB. Similarly, those who have TB with HIV, they have more diffuse lower zone disease. Normally, TB कहाँ होता है? Upper zone में रहता है. यहाँ V/Q ratio will be higher. They will have better oxygen. So these aerobic organisms grow better in the apex of the lung. But HIV may typically it appear in the lower zone. Similarly, biliary disease, adenopathy, and a normal X-ray, they are more common in HIV plus pulmonary TB is what you need to remember. Polygamic lung fields, already we discussed this very much. So what happens in the case of tetralogy of Fallot? There is a pulmonic stenosis. There is a overriding of aorta which opened its mouth into both the left ventricle and right ventricle, overriding of aorta, ventricular septal defect, right ventricular hypertrophy. So because of this pulmonic stenosis, there is a decreased amount of blood flow into the lungs. So that is the reason tetralogy of Fallot leads to polygamic lung fields is what you need to remember. Bird beak appearance on barium swallow, classical of achalasia cardia. Mosaic pattern of the bones is seen in Paget's disease. So this is basically called mosaic pattern in case of Paget's. Similarly, in Paget's there is a osteolytic phase where there is a bone resorption, and that will make the advancing lytic wedge or blade of the grass lesion. It's called blade of the grass lesion is a feature of Paget's disease. Then if you take the skull radiograph, doctor, there will be a lot of cotton wool or osteoporosis circumscripta is another important feature of the Paget's. And how will the vertebrae look like? They look like picture within the picture, frame within the frame, frame within the frame vertebrae are the classical features. Then there is a dense radiodense enlargement, which is diffuse radiodense enlargement of the vertebra, which is called ivory vertebrae, is a classical feature in case of Paget's. For the gallstones, put an ultrasound, you can see the presence of the gallstones. Investigation of choice. Posterior fracture lead to 30% mortality. So what are the indications of thoracotomy? More than 1.5 liters of blood loss. Continuing loss of blood more than 200 ml per hour. If there is a cardiac tamponade, mediastinal injuries, persistent air leak. So in all those scenarios, you do the thoracotomy instead of just intercostal drainage tube. You need to do the urgent thoracotomy. So you have done emergency admission to the burns. What are the indications? Any inhalational injury, typically in the burns, the smoke is inhaled. Any burn requiring fluid resuscitation that requires surgery, or any significant burns of the hands, feet, face, perineum, They are the criteria. Similarly, patients who have a psychiatric social background where you can't send them home, they're all the indications. Cleft lip surgery, when will you do? Palate surgery, when will you do, doctor? 5 to 6 months. So cleft lip surgery is performed between 3 to 6 months. And cleft palate surgery is performed between 6th and 18th month. Now what is the rule of 10 for the cleft lip surgery? Operated at 10 weeks of age with 10 pounds of weight and hemoglobin of 10 gram percentage is what you need to remember. Of all head and neck tumors, adenoid cystic carcinoma has the worst prognosis. Chylothorax most commonly is postoperative complication. So whenever there is any thrombosis of the left or right subclavian vein, the thoracic duct drainage get affected, and that predisposes to the chylothorax is what you need to remember. Lymphangiosarcoma. So after doing mastectomy, that post-irradiated limb, it develops the lymphangiosarcoma. So doctor, once more I want to tell you, have you all downloaded Incus learning app? Yes, sir. Have you gone to the courses? Yes, sir. Under that you have the NEET PG category. Under the NEET PG you have quiz and video type of courses. In the quiz courses you have what is called 40 full scale grand tests in the next 40 days from March 5th to April 15th. Till now you did not study also, no worries. From today, if you can start with Dr. Murali Bharadwaz on Incus, I can guarantee you, vouch for you that you are going to become the winner. Right, doctor? Focus. Focus is all that is important. Morbid obesity. When do we call morbid obesity? If the BMI is more than 40. Spleniculi, most commonly the splenic hilum. Most common primary tumor of spleen is hemangioma. And lymphoma is the most common cause for the neoplastic splenic enlargement is what you need to remember. Delorme's operation. It is for the rectal prolapse, where the surgeon removes some of the prolapsed lining of the rectum and reinforce the muscle of the rectum by stitching, which is called Delorme. Charles Phillips procedure. When there is a recurrent small bowel obstruction because of the adhesions, you have to do repeat adhesionolysis, Noble's plication operation, and Charles Phillips transmesenteric plication. There are all the various methods to manage the adhesions which develop post-operatively is what you need to remember. What do you call toxic megacolon if the diameter is more than 6 centimeters? So whenever the diameter of this enlarged bowel loop is more than 6 centimeters, you call the toxic megacolon. So where does angiodysplasia develop? Ascending colon is the most common location. Solitary rectal ulcer most commonly Anderwall. And Spigalian hernia. Hernia occurring at level of arcuate line. Once more. Hernia is the favorite topic, doctor. You did this question wrong. You need to go back to the Incus app. Go to the courses. Go to 2000 HD videos. And There you have the hernia topic, very well discussed. When you remove the adrenal adenoma, that is 4 centimeters. So more than 4 centimeters, soft tissue calcification, any irregular mass, and tumors, which is if the tumor is unenhanced CT attenuation values, more than 10 Hounsfield units, they're all the indications. Now, renal TB, this is very important MCQ, doctor. So, it is a urinary frequency, increased urinary frequency. It is the earliest symptom of renal tuberculosis. Posterior urethral valve. Typically, it is distal to veriomontanum, is what you need to remember. So, type 1 is most common type, and it extends from the bottom of the veriomontanum distally along the prostatic and membranous urethra. Peyronie's disease. Typically, there is a bowing of the penis during erection due to fibrous clot. Testicular teratoma. How do you treat? You have to do architectomy and retroperitoneal lymph node dissection. Now, the radiograph shown to you, you see air shadow, pneumomediastinum. Whenever any esophagus ruptures, then it releases the air into the mediastinum, which is called, pneumomediastinum, which is seen in Boyer-Harvey's syndrome. In this case, yeah. Now, what is this lesion? This is a coin lesion. Coin lesion. So when do you call coin lesion? If it is more than 4 centimeters, you call coin lesion, doctor. And all coin lesions, the mass should be excised. That's the point. And you should know all the differential diagnosis of a coin lesion. It can be primary pulmonary carcinoma, metastatic carcinoma to the lung, and chondroma, granuloma, AV malformation. Anything can be a coin lesion, is what you should remember. Now, what is this X-ray? It is the rat tail appearance, which is fundamentally achalasia. So what do you see in achalasia? There's a higher than normal incidence of esophageal carcinoma. So achalasia is one of the important risk factors for the development of the esophageal carcinoma. A 76-year-old from Warangal is admitted to the back with back pain, hypotension, and he passes bloody mucus per rectum. So what do you see here? Aortic aneurysmal rupture. So there's a great chance ruptured aortic aneurysm lead to the development of the ischemia of the left colon, is a very important risk factor. Now, conservative management instead of a reconstructive arterial surgery, where is it recommended? So, if there is claudication, so claudication generally indicate mild ischemia, and they can very much be managed without surgery. A 21-year-old medical student is admitted with an emergency after a motorcycle accident. So what do you see here, doctor? You see a biconvex opacity, which is epidural hematoma, which is arterial with a lucid interval. And you need to put a burr hole and drain that bleed is what you should remember. 18-year-old is brought after a driving accident. He cannot move his arms or legs. His flaccid sensory level is at C5. Then what do you want to do? Always in spinal cord injuries, doctor, early the steroid you begin, the better the patient will ultimately be. So high dose intravenous methylprednisolone is administered. Hirschsprung's disease. Basically, autosomal dominant. That's the reason half the offsprings are at risk of the disease is what you need to remember. Of Huntington's disease. Yeah. And what is the phenomena in Huntington, doctor? Variable penetration, genetic imprinting, phenomenon of anticipation. So these are all the genetic, epigenetic phenomena that you need to know, the definitions. Tension band wiring kahan lagate ho? Colles fracture mein. It provides the compressive force which will enable the fracture healing. Hill sac kahan hota hai? Anterior shoulder dislocation mein. There will be a anterior inferior defect, which is Bankert, and posterior lateral defect, which is Hill sac. So, avascular necrosis of the femoral head. Where do you see it very commonly? In the case of the intercapsular fracture neck of the femur, we see the avascular necrosis. In congenital dislocation of the knee joint will be in a hyperextended position. Primary osteoarthritis, genu varus, most common deformity. So varus of the knee, flexion, adduction, external rotation of the hip is what you typically come across. In osteoarthritis is what you need to remember. Now, the most common ligament which is injured in ankle sprain, anterior talofibular. So it is a lateral collateral ligament. Mostly anterior talofibular component is what you need to remember. Now coming to giant cell tumor is epiphyseal in origin. It affects the bones around the knee joint, lower end of the radius. A solitary loculated expansor lytic lesion. It can be eccentric in location and often subchondral lesions. That's how the giant cell tumor presents. And it has got a soap bubble appearance, no calcification, no reactive sclerosis. These are all the classical of giant cell tumor. And tumor reaches, but it does not enter into the adjacent joint. That is the giant cell tumor. Blue sclera is the feature of osteopetrosis. Sequestration क्या होता है? There is a piece of dead bone surrounded by infected tissue is called sequestrum. Involucrum, a dense sclerotic bone overlying the sequestrum is called involucrum. A 11-year-old boy who has got pain in his right leg, The radiograph is being shown. So what is this classical appearance, doctor? You're able to see all those rays which are coming out. So it is the classical of osteosarcomas. Sunburst appearance is what you need to remember. So doctor, let us take a quick break, 2 minutes. We will take a 5-minute break. So a lot of students requested, sir, 50 questions के बाद जरा break दे दो बोल के पूछा ताकि they can be able to refresh. Once more, I want to tell you, every day 6 p.m. next 40 days छोड़ना नहीं, रोज बैठेंगे, डिस्कस करेंगे, संडे हो या मंडे हो, every day. And morning, before coming to the session, please go to the Incus learning app and do the practice of the daily mock test of the day. Okay, so that is the plan. So 5 minutes break. I'll join you in 5 minutes. Please stay online. Yes, sorry for a long break. Yeah, sorry for the long break. We'll continue the class. Yeah, sorry, doctor. We had a little long break. Yes. So, continuing our discussion, visible spectrum of the light in the human being. Typically, the visual spectrum extends from 400 to 700 nanometers, is what you need to remember. Varun, sorry for a long break. Yeah, let us restart. Unexpected. So, infrared, longer than 760. Very good. Varun says, I revised all the 50 in the meantime. Okay. Sometimes, if we take a break, something else will come and fall on us, and we lose a lot of time. So, ultraviolet is shorter than 380 nanometers. Anterior surface of the cornea. So, greater the corneal curvature, greater the chance of getting myopia. So, big-eyed people are all myopic, small-eyed people are all hypermetropic. So, radius of curvature of is 7.8 mm and total refractory power is 59 diopters. So, if you look at the refractive index of the eye is 1. Cornea is 1.38, aqueous humor is 1.33, crystalline lens 1.40, and vitreous is 1.34. Important batti marne wala MCQ. Just take a snapshot of it and then keep it with you. Angular conjunctivitis is usually caused by Moraxella axon-field bacillus. With congenital cataract, if you want to avoid amblyopia, obviously congenital cataract, whenever it is interfering with the passage of the light, this retina, so congenital cataract is causing interruption of passage of light, then there is a suppression that occurs at central level, which is basically called amblyopia. And to avoid that, you need to correct it within the first 6 weeks of birth. When there is a unilateral cataract, rosette-shaped cataract is seen in trauma. Keratic precipitates in the anterior chamber whenever there is any uveitis. Iridocyclitis, anterior uveitis, then that lead to the collection of the keratic precipitates is what you need to remember. So what are mutton fat keratic precipitates? They are very large in shape, greasy white in color, and formed from the macrophages and epithelioid cells is what you need to remember. C-fan retina. C-fan retina. So where do you see C-fan retina? In sickle cell disease, all that viscosity of the blood vessels, blood in the vessels, lead to hypoxic injury. Then stage 1 is peripheral arteriolar constriction. Then stage 2 is peripheral AV anastomosis. Stage 3 is neovascularization, where you find C-fan configuration is what you need to remember. Stage 4 is vitreous hemorrhage. Ultimately, stage 5, there is a tractional retinal detachment in the case of the sickle cell disease, is what you need to remember. Latent squint, which is not manifesting, is called heterophoria, where there is a tendency of the misalignment of the visual axis, which is corrected by the fusion capacity so that it won't appear. There is strabismus, but that is latent. Anti-glaucoma drug, which is long-acting and used only once, timolol. It is the most commonly used beta blocker. It is instilled 1 drop in the affected eye once daily, is what you should remember. In LASIK surgery, what is the laser which is used? Excimer laser. So, whenever there is any noise-induced hearing loss, generally at what frequency will it cause the hearing loss? 2000 to 4000 Hz. And drug-induced ototoxicity, it affects at the level of 4000 to 5000 Hz. Now, what are the important 4 MCQs for tomorrow's exam, NEET PG exam? Least ototoxic netilmicin. Least ototoxic neuromuscular blocker is tobramycin. Most vestibulotoxic is streptomycin. Most cochleotoxic is amikacin. Amikacin more than keramycin, more than netilmicin. They're all cochleotoxic drugs, is what you need to remember. Lux abscess, Bajol abscess, Citali abscess, Harebab. All these things you have to remember. So abscess involving external aortic canal hota hai, lux. So post-auricular abscess occur along zygomatic process in front of sternocleidomastoid. Bejeweled along the middle aspect of mastoid tip. Citally along the posterior belly of the digastric. Lux along the posterior wall of the external auditory canal. The named abscesses of ENT. You have to be 100% sure, doctor. Which of these need to be biopsy for you to rule out the malignancy? Rhinitis caseosa. So, the nasal cholesteatoma, it is a form of chronic rhinitis where a foul smelling cheesy material fills the entire nose. And you need to do a histopathology so that you can rule out the malignancy. Mucosine commonly is found in frontal sinus. The only intrinsic muscle of the larynx which lies outside the laryngeal framework is cricothyroid. So recurrent laryngeal nerve supplies everything but not the cricothyroid, is what you need to remember. A 39-year-old with multiple sclerosis, he has spasticity, clonus. Then what will multiple sclerosis patients will show, doctor? Lermit sign is positive, where there is an electrical sensation which is radiating down the spine, When the neck is passively flexed, is called Lermit sign, is what you need to remember. Once more, if you have done this question wrong, you have to go back to the Incus learning app. Incus learning app के footer में आपको होता है courses, right? TikTok like 3-minute videos, then record a video. YouTube can record a video. Then you have a dashboard. I hope all of you have downloaded the Incus learning app. So the first one is courses. You click on the courses there, you will see NEET PG. You go to NEET PG. Under that, you have quiz type of courses and video type of courses. You go to the video type of courses, you have 2000 HD videos for the NEET PG available. In that, in the general medicine chapter, you will see multiple sclerosis. Beautifully discussed. 20 minutes में आप multiple sclerosis में champion बन जाओगे. You have to do the revision. Cancer of the tongue. Prophylactic irradiation of the neck nodes. It is indicated whenever the primary cancer of the tongue is treated by irradiation. So you need to do the prophylactic irradiation of the neck nodes. So tonsils, what is the branchial arch? From where they develop? They develop from second pharyngeal pouch. Once more, doctor, ये बट्टी मारने वाला आइटम है. आप गर्मा गर्म रिविजन करो कल के एग्जाम के लिए. Pharyngeal pouch 1. What develops from the pharyngeal pouch 1, doctor? Eustachian tubes, epithelial lining and middle ear cavity. 1. Similarly, crypt of the palatine tonsil from the 2. Inferior parathyroid glands from the 3. Superior from the 4. ये ऊपर नीचे है. 3 पहला आता है मगर inferior. 4 बाद में आता है but superior. So 3 is inferior, 4 is superior. Parathyroid gland will develop. Ultimobranchial body from the 4th pharyngeal pouch. Thymus from the 3rd pharyngeal pouch. कल के नीट पीजी में जरूर आने वाला क्वेश्चन है डॉक्टर. Killian's dehiscence. So basically Killian's dehiscence is a triangular area in the posterior wall of the hypopharynx between the oblique and the horizontal lines of fibers of the inferior constrictor. Oblique and horizontal fibers of the inferior constrictor is the Killian's dehiscence. Mucosal elevation at the junction of the nasopharynx and oropharynx. You call it as Passavant's ridge is what you need to remember. And it basically helps in sealing the oropharyngeal isthmus. So the different types of abortion, how do you define? Depending on os is open, os is closed, os is open, os is closed, based on that. Dilated open os with the abortus in the uterus, it's called inevitable abortion. Then what is threatened abortion? Without cervical dilatation or change in cervical consistency, you call threatened. So os is closed in threatened abortion, os is open in inevitable abortion. That's what you need to appreciate. Similarly, incomplete abortion, there also os is open. Once more, complete abortion, os is closed. Even missed abortion, os is closed. So HIV transmission is maximum during vaginal delivery. So what is the chance of perinatal vertical transmission of the HIV, doctor? 25 to 35%. Interspinous diameter, all maternal pelvis, fetal skull. बोल के एक टॉपिक है डॉक्टर. Once more, Incus में, Incus Act, I advise you, all of you, to go to the video courses में NEET PG में under NEET PG, you have 2000 HD videos का program available है. What is your job? Morning, सुबह उठते ही, what is the today's grand test? 100 questions वाला. All the 40 days, next to 40 days, every day we have a grand test of that. So revision करना, quickly solve करना पेपर को, solve करके शाम 6 बजे को डॉक्टर मुरली भारद्वाज आएगा, आपका रिविजन हो जाएगा. ठीक है? So every day you need to pick up 10 topics or 20 topics, analysis कर लो, कहाँ wrong हो रहा है, and then go back to the 2000 HD videos and do the revision. Everything you can do it on your mobile app. Incus. Interspinous diameter, typically 10 centimeters. So interspinous is the smallest diameter and it is the transverse diameter of the mid pelvis, which is the plane of least pelvic dimensions. And obstetrical conjugate normally is more than 10 centimeters. The longest fetal skull diameter, favorite question, submentovertical diameter. अच्छा डॉक्टर एक फोटो ले लो, चिट्ठी लिख लो, पैंट के पीछे पॉकेट में रखो, कुछ भी करो मगर भूलना नहीं मेरे यारो. 1 MCQ कंपल्सरी निकलेगा यहां से. दिस इज अनदर बट्टी मारने वाला आइटम है. Mentovertical will be 14.5 centimeters, submentovertical 11.5, suboccipitofrontal 10, suboccipitobregmatic 9.5, biparietal is 9.5. Don't forget. Face to pubis compression. It is the submentobregmatic diameter. The widest diameter of the fetal head when negotiating the pelvis is the submentobregmatic. Submentobregmatic is 10.2 centimeters and 0.7 centimeters more than the suboccipitobregmatic. So now, lowermost portion of the presenting fetal part, the ischial spine, is at the ischial spine. उसका मतलब क्या होता है? What is the station? That is called zero station. So basically the station is reported as negative numbers -1 to -5. If the presenting part lies above the ischial spines inside the pelvis, if the presenting part lies below the ischial spines, it is reported +1 to +5. So basically at the level of the ischial spine, it is called zero station, is what you need to remember. If there is an entrapped breach, how do you operate? It is the Durson's operation, which is the surgery for the entrapped breach, is what you need to remember. When you call fetal tachycardia, if the fetal heart rate is more than 160, so typically fetal bradycardia means fetal heart rate less than 110. Tachycardia means more than 160. And any 120 to 160 is considered the normal fetal heart rate baseline, is what you need to remember. So all of you know what is the download link of the Incus app. All our students are our brand ambassadors. So my personal request to all of you to make this popular is, please drop 1 or 2 good reviews on the Google Play Store. And please paste this download link of the app and write 1 or 2 good words about the Incus app and our evening YouTube live classes. in your classmates' WhatsApp groups, Telegram groups of NEET PG preparation everywhere. So we don't do a lot of marketing, and we believe that students should be the source of the branding and promotion. And tomorrow when you get the seat, please create a 3-minute video. How was your journey? And drop it in Incus learning app as a 3-minute video. Even while you are studying, please make a 3-minute videos. Just write it on a paper and then make a video and then upload it into the Incus app. If every student puts about 5 videos every day of revision videos, imagine if there are about 100 students doing that. 500 3-minute free videos आएगा Incus app में. There is no need for any other commercial coaching center को पे करने का जरूरत नहीं है. आपके friends में ही revision videos डाल सकते. So please do that. While you are studying, don't waste your notes. And also there is a fun. You know, if you are reading alone, it will be boring. But you make a 3-minute video, revision video, and put it into Incus app. Just like TikTok, you can record it and then upload. People will like it, share it, become your follower, many things. There's a lot of fun. So what are the criteria to diagnose gestational diabetes using the glucose tolerance test? Wow, that is very good, Varun. My sister cleared NEET PG 5 years ago because of these daily 100 MCQ tests you used to take. Kindly continue this until the exam. We have been waiting for this for a long time. I'm also waiting for this. Varun, wonderful guys like you are always an inspiration for teachers like us. Vice versa, I want all our students also to contribute. You know, who is the best teacher, doctor, in our life? Who is our best teacher? Tell me. It is not some coaching guru who comes from Delhi in a flight and then morning to evening he will be sweating out. What do we learn from that kind of crowded classrooms? And always our classmates, our juniors, our seniors, they are our best teachers. Most of the times, the best things that we learned in our life are all free, supposed to be free. So that is the reason Incus is being created as an app with that purpose. Every student 3-4 videos 3-minute wala dal dega, revision wala. All the students collectively put about 200-300 videos every day, 3-minute videos, revising one or the other concept. And you don't need anything else in this world. That is the best study material, right? So now, doctor. So glucose at 2 hours more than 155 milligrams per deciliter is very important. So I leave the literature for you. Fasting 1 hour, 2 hours, 3 hours. Then 100 grams GTT, 75 grams GTT. What are the cutoff values? This is the most important table. You only imagine diabetes, pregnancy, pregnancy, diabetes, favorite area of the examiner. So you want to make a diagnosis of ectopic pregnancy. When will you make it? When the beta HCG is more than 1500 milli-international units per ml. So if you do transvaginal sonography, it detects the intrauterine gestations as early as 1 week after missed period when the beta HCG is more than 1500 international units per liter. Beta HCG can be detected in maternal serum as early as 7 to 8 days after the ovulation. Then the serum beta HCG increase in exponential fashion in early pregnancy. And every 2 days, beta HCG concentration tend to double. So the doubling time is 48 hours. Uterine height is more than the corresponding gestational age. Patient is also having hyperemesis and parvaginal bleeding. Think of hydatiform mole. So what are the most common type of conjointins, doctor? Sina ek ho gaya. Sinu thoraco-phagus is what you need to remember. Now, intrauterine death, whenever intrauterine death is there, it can lead to DIC and hypofibrinogenemia. What are the most common cause for the renal failure in obstetrics? It is the pregnancy-induced hypertension. Self-breast examination by the females. At which time? 7 to 10 days after the menses. After the start of the menstrual period, 7th to 10th day. Uterine fibroid during pregnancy lead to red degeneration. Most common degeneration of the fibroid, hyaline degeneration. Usually at or around the menopause, what you get? Fatty degeneration. Cystic degeneration usually occurs after menopause and is common in interstitial fibroids. Calcific degeneration is seen in subserous fibroids. Now, what are the indications for doing colposcopy? One of the favorite MCQs of the examiner. So, any abnormal pap smear, if you want to do a colposcopy, directed biopsy, if you want to follow up the cases who are being treated conservatively, colposcopy is indicated. So I leave the literature for you, doctor. ये तो बट्टी भरने वाला item है, important item, favorite question, indications of colposcopy. Whenever you are doing a repair of the cervical tear, where will you put the first stitch? Above the angle. So above the apex of the laceration, to control the bleeding from the vessels that have retracted, you have to put the first stitch. Strawberry cervix, trichomonas vaginalis. Molar pregnancy, what are the complications? It can lead to thyrotoxicosis because HCG has a same structure as that of the TSH. So it can lead to thyrotoxicosis, pregnancy-induced hypertension, ARDS, anything can happen. So molar pregnancy where cardiac failure does not happen. Now, beta HCG, when will it disappear? Usually after a molar pregnancy, by 8 weeks of time, the beta HCG will disappear. Then with regard to the vasa previa, so vasa previa may, it is the fetal hemorrhage which is the contributor of the bleeding. So vasa previa, like placenta previa, leads to antepartum hemorrhage contributed by the fetal hemorrhage is what you need to understand. So which type of placenta previa? You can't, you have to do cesarean hysterectomy, placenta accreta, where there's a deeper penetration into the myometrium. You can't simply remove the placenta. You have to do hysterectomy. McAfee is conservative treatment of placenta previa. When is it contraindicated? If the fetus is dead, if the pregnancy has reached 38 weeks, if there is a profuse bleeding, then But if the fetus is IUGR, McAfee treatment is applicable. Whereas if the fetus is dead, or if profuse bleeding starts, or the pregnancy has reached 38 weeks, then termination of the pregnancy is desirable. A multigravida presents at 32 weeks gestation with a type 2 placenta previa and a breech. What is the best treatment, doctor? Type 2 means almost darwaza band ho gaya. There is a very low implantation of that abnormal placenta closer to cervical os. That is the reason there is only elective cesarean section near term is the one which is indicated. Which tocolytic drug is safe in preventing preterm in placenta previa? Max sulfate drip. Because if you use ritodrin, beta-mimetics or nifedipine or anything, they lead to tachycardia, hypertension. That's the reason you don't use them as a tocolytic if there is a placenta previa. The only one which is preferred will be magnesium sulfate is what you need to remember. A woman 34 weeks pregnant presents with abruptio in the early labor. The fetal heart sound is not heard. So what is your management? You have to do the artificial rupture of membrane plus oxytocin drip. Because the woman is diagnosed with abruptio placenta and labor should be expedited by ARM, and you won't let it to progress as a normal delivery. And if the fetus is dead, then there's no role for cesarean. How long does parenteral iron, if you take, it will show improvement. It takes 4 to 8 weeks to improve the hemoglobin percentage. So what are the indications of exchange transfusion? So any severe anemia with the cardiac failure, to avoid overloading of circulation, you need to do exchange transfusion. So what is the most risky period during pregnancy in a woman with cardiac lesion, doctor? It is 32 to 34 weeks, because that is the time where, just like a full moon day, the Indian Ocean is in full tide. Like that, the cardiac output is maximum, blood volume is there. So that is the reason, that is the time where if you are having a stenotic lesion, always remember, stenotic valvular heart lesions worsen with pregnancy. Regurgitant valvular lesions improve with pregnancy is what you need to remember. So doctor, that brings us to the end of this wonderful evening. Did you pick up those 10 topics that you need to improve? Yes. Every day, next 40 days करते हैं. सुबह उठते ही आप रीडिंग रूम को जाते ही Incus ऐप ओपन करो, 100 MCQs का like a quiz, ting 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 ting, answers खत्म करो, and there is a history where you find the PowerPoint relevant explanations and you can do the review. Then evening, 6 baje ko, Dr. Murali Bharadwaz is all yours. And 1 hour, they will discuss all the 100 questions. Then you pick up 10 topics that you need to improve at the end of this discussion. By the time it is late night, you finish. Every day, 10 topics, 10 topics, 10 topics, khatam karo. Seat nahi hai to mera zimmedari. Barabar? But Rose, don't forget to come down for this evening YouTube discussion and solve the paper in the morning. That is most important. Thank you very much and enjoy. You're all born to become the winners. And you are the hope of the India. Because you are going to be postgraduates saving lives. And guys like us, one day we'll get MI. No worries. Because we fall in the safe hands of you. Guys who are becoming the tomorrow's cardiologists. Right? So thank you very much and see you all tomorrow evening. Good night.